Hi, everyone. Good morning. Thank you so much for taking the time to join us for today's webinar, Homelessness and Health in Arizona. We will be getting started shortly. Just a few things to mention as participants are joining the Zoom webinar this morning. You can see us, but we can't see you. But you are an important part of the conversation. So if you would like to tell us who you are and where you're from, and just drop your name and anything you'd like to ask our participants or make sure we cover in the chat today, you can just go ahead and mention that. Throughout the conversation this morning, we will be taking audience questions. So feel free to ask any questions you might have of our panelists in the chat, and we will be getting to as many of those as we can today. So once again, thank you so much for taking the time to join us for today's webinar, Homelessness and Health in Arizona. My name is Serena Unrein, and I'm with the Arizona Partnership for Healthy Communities, which is managed by LISC Phoenix. Once a quarter, we bring together practitioners from various sectors to share best practices, data, and policies to improve community health. We're hosting today's webinar with Flagstaff Shelter Services to focus on how homelessness and a lack of access to housing intersects with health. We have expert panelists from across the state who will share some of the challenges they're facing right now, as well as ideas for how other sectors can support and collaborate with them. So a couple of housekeeping things to mention again. If you want to introduce yourself in the chat so we know who all is joining us and where you're from, that would be great. We can not see you, but you can see us. And we want you to know that even though you're not on screen, you are an important part of the conversation. So please feel free to ask any questions you have, share your ideas and thoughts in the chat. We always love having a robust audience chat during these conversations. We will be recording this webinar and sending out a link to everyone who registered for today's webinar. So please feel free to share that recording with your friends and colleagues. And the follow-up email will also include any links to resources our speakers referenced during today's webinar. I'll go ahead and turn it over to our panelists and have each of them introduce themselves so we can get to know them a little bit better. So if each of you would share your name and where you work and any background information, that would be great. And Ross, I'm going to go ahead and start with you as our co-host for today's webinar.
Hi, everyone. I'm going to start by saying I'm sorry, I'm still trying to get my video to work, but my name is Schaefer, and I'm the Executive Director of Flagstaff Shelter Services. And I'm thrilled to be here today to chat with you all and just see what we can learn from each other. Thank you.
Thanks, Ross. We all understand technical difficulties, and it just goes to show how adept everyone in this sector is at just rolling with things and figuring it out as we go. Terrance, I'll have you introduce yourself.
Good morning, everybody. My name is Terrance Watkins. I am the Executive Director of Housing for Catholic Community Services of Southern Arizona. We cover Pima, Cochise, Graham, Greenlee, Santa Cruz, Yuma, County, and Gila counties. And we do everything from DV, regular shelters, transitional housing, HUD-funded housing programs, access path. We are just a jack of all trades when it comes to housing in Southern Arizona.
Love it. And last but of course not least, Nathan.
Hey everyone, Nathan Smith. I'm the CEO of Central Arizona Shelter Services, broadcasting to you live from Lake Tekapo outside of Christchurch, New Zealand. So hopefully the Wi-Fi holds up. It's been pretty good so far. We at CAS provide emergency shelter services across 3 primary interventions. We have a 600-bed shelter in the downtown Phoenix area that serves adults of all ages, 18 and up. We have a family shelter, 30 units of a converted apartment complex for families of all sizes and various constructions. And we have a 130-unit shelter for older adults who are 55 plus. We converted a motel into that intervention. So 2 non-congregate sites and 1 very, very large congregate site. And more than anything else, CAS is an emergency shelter provider. It's a pleasure to be here with you all today.
Thank you so much. We're so grateful that you are joining us from New Zealand and taking the time to do this during your travels, Nathan. That's very generous of you to share your time like that. I would love to get us started by just asking each of you to share some of the biggest challenges your organizations are currently facing as you work with Arizona's unhoused population. Terrance, since you didn't turn your mute button back on, I'll start with you.
Okay. You have to watch your mouth when you talk these days. The political landscape continues to change. Funding that was once there is no longer there. But then there's opportunities for additional funding if it comes. So I would say right now the biggest worry that we have is the uncertainty of if we're going to be able to continue to provide the services that we have provided. If so, in what capacity, and what the future of housing will look like in Southern Arizona. So just that uncertainty of what we have to work with and what we're facing, I would say is the biggest issue that I'm currently working with.
Yeah, and I will go with that and add on to it that I think one of the big things that we're having challenges with is just, and I know people know this all the time, but I'm pushing this because there's legislation being proposed constantly that can ease the burden of getting people into housing. So as a shelter provider, our number one goal, we have two main goals. One, we're a public health benefit when people are off the streets and they're in a safe place, they're out of the conditions, and they have food and clothing on their backs and things of that nature. So that's one big thing. But really, our ultimate goal is to get everyone in housing that they can permanently sustain. And when we're unable to do that because the flood of people coming in is more than what we can handle on the back end in terms of getting people out, then we're facing a lack of success. Then you couple that with the uncertainty, the selectiveness that funders and government payers and things of that nature, when they're looking for agencies that are showing really high outcomes, but then it's really hard to get really high outcomes. So then it comes back to Terrance's point, where amidst all that uncertainty, it's difficult to get funded. That's one of the big challenges I would say compounds on top of the funding issue is long story short, it's just hard to find places for people to go of all ages, of all family sizes. I'll give you two examples on this quickly. On the senior side, for people with fixed incomes, how do you find affordable housing consistently with people on fixed incomes? And then families who need a certain number of units, if they have 8 people in their household, it's really difficult to find affordable housing for people of, whose large family sizes. And then again, it's hard to therefore show outcomes and then be competitive in the funding landscape, to Terrance's point.
And Ross,
Yeah.
go ahead.
Yeah,
Sorry,
go ahead.
Ross.
Sorry. No, go ahead.
I was just going to turn it over to you.
Yeah. So I'm going to give up on my camera so I can stay present with you all because it's going to make me crazy otherwise. I apologize for that. I think probably some of our biggest challenges right now, really, I mean, Terrance and Nate certainly said funding, resources, housing, all of that. I think that, some of us have been doing this for a pretty long time, and we've seen the ebbs and flows of changing best practice and certainly changing how money has kind of flown into our system. And, one of the things that I feel consistently like I'm grappling with is, headed into COVID, it felt like we really kind of had a handle on things. And I don't want to mean that we had it all figured out and it was, everything was hunky dory and there weren't people experiencing homelessness. What I mean is it felt like for the first time in a long time that we had solutions that had data behind them and were person-centered and were headed in the right direction. And there were communities getting to functional zero. And, we were seeing real outcomes. And COVID came, and we all obviously felt what that looked like for people experiencing homelessness, especially in congregate settings and in places when we were all wiping our groceries down. We're also having conversations around people sleeping in shelter, certainly less than 6 feet from each other, and kind of how we grappled through that. Some of us stood up hotels, and some of us, lots of intervention and new ideas came to be. But I think one of the net negatives, along with COVID in general and what it took from us, I think is really so much of the housing stock almost disappeared. We saw what happened to property managers as the eviction moratorium took hold and how that really came back with, frankly, a vengeance for how we were housing people. That housing first, those units almost disappeared overnight. In Flagstaff, they got a fresh coat of paint and maybe a new carpet, and they were, $1,500 more a month now. And so, the accessibility for the folks that we're seeing and the rising senior population that is taking hold. Our numbers last year were a third of the folks we serve were 55 and older. And we know that 55 and older is a senior citizen when it comes to the definition of homelessness and how long they're expected to live. So that is startling. Those folks are on fixed incomes. They cannot afford what we have access to. And so that theory of housing first and how we make that work, I think still fundamentally, I don't think housing first is a four-letter word. I think that's the direction we need to go, and I'm kind of a heart and soul believer there. But if there's not the units and we can't build our way out of it, I think we need other tools in the tool belt to be able to solve this. And so I think that's where I feel the most frustration right now, if I'm honest. And with my camera, I have a lot of frustration there too, as well, if you must know.
Thanks, Ross. We might not see you, but your words are coming through loud and clear. So we appreciate that. Terrance, you should just go ahead and hop right in.
All right. So Ross brought up a really good point surrounding COVID funding. During COVID, we saw a massive influx of funds that had never been available. And it was billions of dollars that are available right now, and you have to spend them right now. So then it was great. We started housing people, but with that, the market changed to our point, and the rents almost doubled or tripled here in Tucson. So yeah, while those dollars were here, it was great. We were able to keep up. But now that all of those dollars went away and all of these rents are higher, we're finding it even harder to deal with, to find a solution for individuals who are on like fixed income. So it's not just, for me, it's not just the seniors, it's those on SSI and SSDI veteran benefits. Because instead of giving that massive influx of funding all at one time, if that could have been parsed out and spread, and now we can plan for the future on how we can effectively use those funds to be able to come up with a good, viable, long, sustainable solution for these participants. But that wasn't the case. So with the COVID money, it was both a blessing and a curse.
On the blessing side, Ross mentioned some tools that, we have been picked up along the way. And one of the things that for me, COVID showed though, and this is particularly true in Maricopa County where I'm most familiar. So I realize, I don't know if this is the case in Tucson, Pima, or in Balance of State, but in the Maricopa Continuum of Care, in 2024, we saw a one-time dip in the number of people who were experiencing homelessness, according to the point in time count anyway, in 2024, which sort of correlates with peak ARPA funding. And so what it indicated was this, even though it was clunky, I feel as though our communities who are serving people experiencing homelessness were ill-prepared for that level of windfall. It did show, though, that there's a positive correlation between investment in the homelessness and housing sector and a decrease in homelessness. So it would be great to take a step back and say, what actually worked in those cases? I think one of the things that worked was there was a lot more rental assistance for one, and there were emergency housing vouchers or housing choice vouchers, excuse me, for two, right? So a variety of vouchers for people who are experiencing homelessness, who are chronically homeless, which is one of the groups that CAS works with a lot, who are very challenging to place. And those things had a really strong positive correlation with either keeping people in their homes or quickly and permanently resolving their homelessness. Why I think that's scary is because, to Ross's point, there's a fear that we're beginning to move away from the housing, not the fear. I mean, we're absolutely blatantly moving away from the housing first model. And no one's people so our federal government is not being shy about that. You're not shy about it in many parts of the state government at this point. And in fact, those were some of the things that helped our homelessness numbers tick down. So it would be great if a windfall like that came again. I feel as though our communities are more prepared. We've seen proofs of concept. We saw what works. Again, prevention and housing and putting the dollars into those places. And then, quite frankly, we expanded shelter in that time too. So we're able to even keep people in safe spaces. And if that were to happen again, I think we would see the benefit of those numbers going down much more quickly, having just experienced it a few years ago. So I'm sort of on the optimistic side, preparing for the next windfall. Hopefully it doesn't take a disaster to create it, but whatever creates it, the silver lining will be we're much more prepared, having seen what worked before. We have new tools in our kit.
Thanks for sharing those experiences. One of the things that I think really came out of the COVID experience was just thinking differently about how to improve the health and well-being of the unhoused population in Arizona. We knew that having safe, accessible housing was the foundation for health, but beyond having a roof over someone's head, what did you discover either during COVID or during your time working at your organization about what we can do to improve health and well-being?
Sure, I can jump on it first, and then from a shelter provider standpoint, so yeah, I'll isolate it to that type of intervention. For us, a lot of what we do is about preparation. So we want to help people obviously get out of the conditions that they're in, but then prepare for their next step. We have people for a relatively short window. Some people are with us much longer than they or we want them to be because of reasons outside of anyone's control. But then for the most part, that's not the case. In some of our shelters, we have an average length of stay of 41 days. So in that time period, our job is to prepare people for their next step. So especially for folks who have been homeless for many years and have adapted to that kind of lifestyle who are moving into housing, how do we help them get ready? Some of the things that we do is on our side, we've now stood up a on-site behavioral health program that supports people who are experiencing all sorts of things that are in our shelter. We give them through that the kinds of living skills, the psychosocial skills, the sorts of resources that are necessary to stay successful in their housing situation. Another of the things that we do, and I love this particularly at some of our non-congregate sites, is we help people build community. So I'll take you over to the Haven, for example, which is our 55 plus shelter. One of the things that we're really driving there is a sense of community and making sure that we facilitate these opportunities for folks to connect and get to know each other and get used to being around other people instead of being so much in isolation. Isolation is one of the things that will absolutely cause people to become homeless because they lack a support system, and those sorts of things. So one of my favorite things I've seen happen out of there is people trusting each other enough to move into shared housing. They bring their costs down and they have a partner. They have someone that they can hang out with, someone they can debrief with, someone they can do life with. And all the things around preparation, whether it's, making sure that people are connected to healthcare resources that exist in the community and understand how they can stay connected to them after they move into housing. Same with behavioral health. We get people iPads at our older adult facility so that they can take advantage of telemedicine when they move on from us. And so all sorts of things, again, it comes back to, from a shelter provider, from my humble perspective, is making sure that we give people the resources to be prepared for that next step so that they know how to sustain success in their housing placement.
I'll jump in. Nathan, I love everything you said. I had actually pre-written my response, and it was you hit the nail right on the head.
My bad.
Well, no, it's great. It's great. And that's what it was, is that finally housing is now being looked at as a universal. This is how we fix individuals who are experiencing homelessness. Housing itself is just roof, walls, and floors, a couple windows. But in order for them to be secure and stable in that housing, or to move on even better housing, we need to start working on addressing all of those social determinants of health. So it's, education, employment, making sure you're going to see your doctor, your behavioral health provider. The level of housing case management services has now increased. And that's through a bunch of things such as the H2O program, Arizona Complete Health, PSH. But we are actually increasing the levels, the requirement, the expectation of the services that are being provided to the members. So everyone now is getting a comprehensive assessment. Based on that assessment, where we're identifying all of the different concerns this individual has. Great, now let's create a service plan. Let's start working on addressing that service plan. Let's make the goals measurable. As they attain them, let's knock them off and put a different one on. And so that increasing and encompassing all of that level of services into housing, I think, is one of the best things that came out of the past 5 or 6 years that we've been addressing homelessness.
Mm-hmm. Yeah, I mean, I really agree with you guys as usual. I think that one of the really beautiful things that I think as a service provider, we functionally knew for as long as we've been doing this. But really, I think the beautiful lesson of COVID is how your health is my health. And I think what that means to me is I think most people, and certainly not, I understand that I'm about to say a sweeping statement that many people in here will have had this experience. So let me validate that. But I think the average person walking down the street does not directly know someone that they maybe would conventionally think of as someone experiencing homelessness. So let me just say that. I think the most of the people that I meet in day to day do not know someone that they conventionally think of as homeless. So maybe they're flying a sign on the street, maybe they're sleeping, behind a Taco Bell, that kind of thing. Most people don't necessarily say, yeah, that's Jimmy. I know that guy. How that translates to what we're talking about in my mind is that it's not like you have a direct line every day where you think that person sleeping behind the Taco Bell is related to my health in this other way. And I think that can be a weaponized thing, right? You can often have this otherism around how you think about why that person's health matters to your health and that kind of thing. And so personally, I think COVID was this really beautiful love letter to how we are neighbors and connected in all these different ways that maybe you didn't historically think of on a day to day, and how you talk to your kids about homelessness, and maybe you don't walk past that person that's laying on the ground or that kind of thing. Maybe you just think about that differently and think. So I think that is this kind of collective consciousness that maybe started to form at that time. Maybe it's weaned at this point, but I think it started. And then I think the other thing is that I can absolutely point to two big hotel buildings that Flagstaff Shelter Services owns now that are providing non-congregate housing for people, right? And many programs like ours have done that. And that is a direct result, I think, of seeing what four walls and a roof does for people. And when you think about that problem on a grand scale of quickness, like what happens in your community when you put 300 people overnight in hotels of their own instead of sleeping in a congregate shelter? Well, it turns out in Flagstaff, we saw 25% decrease in crime, both violent and nonviolent. We saw health outcomes shoot through the roof because people were getting a good night's sleep and had a shower that they could get to, and they could have their documents laid out on a dresser that they weren't worried were going to be stolen. So I think you see these really practical ways that really those lessons came, in my opinion, most aggressively post-COVID. So I think that there are absolutely lessons there. It's unfortunate that we had to go through what we went through and lose so many people and that kind of thing. But there's definitely areas of lessons that I think we took from that.
Uh, yeah, there's a question from Nicole. Serena, you want us to just go after it or what?
Sure, we definitely can. Before we get to Nicole's question, I wanted to just say congrats to Ross and Flagstaff Shelter Services, because the two hotels that's a big deal. But also, I just wanted to congratulate you because I think you just had your 20th anniversary celebration this last weekend. So
Thank you.
Congrats.
We
That's
did.
that's a big deal.
Yeah. Yeah. Thank you.
So Nicole in the chat asks the question of the panelists, what strategies do you use to get clients to engage in services that can help prepare them for success? So that's a great question. And Nathan, I'll turn it over to you. But before that, I just wanted to remind everyone who's listening in today that you can also ask questions in the chat. So feel free to ask any questions that might be top of mind to you. So, but thanks, Nicole, for the question. Nathan, what are your thoughts?
Oh, first off, also, if you haven't gotten up to Northern Arizona to go visit that new intervention that Ross is talking about, you should, and explore what it's like to see everything that she mentioned, getting people into congregate style housing, shelter, and all that that means for preparing them for the next step is incredible. And what they're doing up there, I love. So get up there and see that if you haven't already. And so to answer the question, we explore a few things in terms of strategies to get clients to engage in services. And it looks different for us at CAS based on the shelter type that we're talking about. So one of the things that, if you hear me enough, you hear me fuss about quite a bit, is at my 600-bed shelter, I've got 4 case managers. So that's obviously not nearly enough people to engage in services. So at that location alone, participation in case management services is not a requirement, whereas at the 2 non-congregate sites, it is. People have to engage in services as a condition of their stay. And so that's one thing is, so one strategy we have is, hey, listen, there's a lot of people who are out here experiencing homelessness. We're very low barrier and we make it as easy as possible in the places where it's required to engage in services, but you can't say no. Because if that's the case, then we're going to have to move someone else in here who's ready to say yes, and we'll give you some time and we'll take the pressure off on the front end. But there will come a point where we really have to get engaged in services because we need to move people along and help people be successful. At our congregate site, it's a little different because again, 600 people and 4 case managers means I cannot put everybody on a caseload. So there it's a whole lot of enticing people. We have a day room. The day room has one of my favorite things. I often say it's similar to if you go to a school like in the hood where the calendar is empty versus a school up in the suburbs where the calendar is full of chess club and track club and all these sorts of things. It's the difference in kids just saying, sure, I'll try that thing. So we try to do that at our congregate site. We have a calendar full of stuff. We bring people in for meals, for like worship, and we bring people in for game nights, karaoke nights, and then haircuts. And also we bring them in for behavioral health services. And all of these partners bring all of this activity to life. And what we find there is it entices people because they see something on the calendar and they say, sure. And we hit them like, hey, we would love to work with you some more. Would you be willing to help us get you on a case plan and work your way out of shelter into a place that is a really good fit for you? If we can find that, let us help you with that. And so we try to entice people and have to get a lot more creative by just filling up the calendar with partners. And I think that's one of my, because we're challenged, because we can't have the requirement with as many people as we have and the few resources that we have, I kind of like that sort of creativity. But then we also, and listen, and whether this is popular or not makes no difference to me. For me, also, it's about the carrot, but then at the end of the day, it's if you get to the 90-day mark, you're allowed to stay here 90 days, do absolutely nothing. We'll leave you be. But along the way, we're saying, hey, listen, there are a lot of people who are on the streets and you will time out and be able to come back eventually, but we need to open up the gates for other people to come in because some of them may actually want to take advantage of services. So even at the congregate site, there is a stick at the end, if you will, that says you're free to stay here forever for 90 days, no problem. But we have to put the exit date in at that point and get someone else in, and you can come back in another time. But I think what I do love most is trying to entice people into the service by getting creative with all of our partnerships.
So I am glad Nathan went first. When I saw the question popped up, I had like sweat beads because generally what I say is not popular. I believe it's not, to me, it's not about a stick or a carrot. It's we share the same goal as you, and that is to help you address all of the social determinants of health that have gotten you in this situation. So in all of my transitional housing programs, it's clear right from day one. It's part of the it's a requirement of your participation in the program. Now, with that being said, I still believe in member voice and choice. I want to walk beside you and help you achieve your mission. So we did the comprehensive assessment with them. We still created a service plan. They got to identify the goals that they would like to work on and what interventions they would like to do. And my staff are here to like, all right, I'm going to meet with you on Tuesday so we can start addressing this one. And then my staff come on Tuesday and they start working with them. They move the goals along. But it is a requirement that you participate in case management for transitional housing. With our HUD-funded programs, currently, you cannot make that requirement. So it's more of like it's an enticing. When we developed our transitional housing program, I did so because I believe in housing first, but not housing only. I've literally come to my staff member and said, hey, I can't get this person to engage. I've gone with them to the member's house. The member opened the door after knocking for about 10 minutes, was smoking a drug pipe, flipped us off and slammed the door. And so at the end of this person's rapid rehousing program, there was no funding. They achieved nothing. And so they just went back to the street. That was not a benefit to them or anyone else. So I believe that, look, we have this finite resource and it's finite. And with all of the political infighting, we have to be able to show that this intervention is going to work. And so if we're here, we're working, we're rocking with it. And then that way we can help you move on to the next level. Because when you're at the end of your 90 days, 60 days, my transitional housing is a year, because I understand going from homeless in a shelter with kids to in your own place, there's a lot there's a lot we need to accomplish. If you don't have a GED, great, that's enough time. Let's get you enrolled in GED classes. If you don't have a resume, great, let's get you one going. And so we can get you a part-time job while you're still in school. You have a regular job, great, let's get you enrolled in some kind of vocational class. Let's do all of the steps that we need to do that will actually increase your earning potential. But if there is no requirement for the person to engage, then it's kind of, we're still at the end of that, as Nathan said, we gave you carrots the whole way, but now at the 90 days, we're sorry. And that, to me, it's hurtful for me. They're like, sorry, well, we didn't achieve nothing, so you got to go. And we don't really have a place for you. So that's generally where I go on. Ross?
Yeah, I mean, listen, what I really dislike about sometimes presentations where you're hearing from providers is like all three of us are executive directors or CEOs, and I think that our job is often to do the dance of like, look how great our services are, look what we're doing, look at our numbers, and I think the thing is that at the end of the day, this is really, really, really hard work. And, I think that I think looking through the attendees of this is like, we don't need to tell you about how great we are. You know that this is a really hard nut to crack. And, we don't get it right all the time. I mean, certainly we don't at Flag Shelter, and Terrance probably does, but I think
Nathan
the
does
thing
not.
is, and Nathan, I know you don't. Just I'm just kidding. You definitely do too. But I think that, I guess, the thing is that I was talking to a case manager this morning about, she was like, I just don't know that this family that she's working with is doing what they need to do. And I think once we start really breaking down, like, hey, well, let's talk about the kinds of questions that you're asking and how you're asking them. When I sit down at the kitchen table every night with my kids and I ask them, how was your day? I'm no doubt I would put every dollar I've got that my kid is going to say, fine or good. But if I say, what made you really laugh today? He's going to tell me something. It might not be funny, but it's going to tell me, he's going to say something else about his day. And I think that's kind of how we have to talk and reframe how we're talking to the folks that are trying to get housed. Like, okay, I know you're not going to get housing next week without all these other things in place. And so what are we doing to try to start breaking down the answers to what's keeping you from making those things happen? And I think that's kind of how we have to think about this from a human perspective of what motivates people. And, I think to Terrance's point, yeah, housing first, but not housing only. And I think when we're looking at the fidelity of the actual model of housing first, it was never meant to be housing only. It was meant to be heavy. The real work started once they were housed, and those wraparound services and how you motivate people to keep things. And, at the end of the day, setting goals that the participant themselves set as opposed to us talent setting for them is really going to be, I think, probably the biggest motivator that we can lean on. So it's not easy, and I don't think we have great answers for you, but we try different things every day because not everything works for the same people. So
One thing I will say, just because you mentioned one of your staff, I have one of our program directors who's actually gotten pretty creative about this. I don't know why this is so mind blowing to me, but just to watch it happen in practice has been pretty incredible. So when people would we get rule violations. I mean, y'all know, like rule violations, and one of the big rule violations we get is clutter. It is so bad. I mean, we've got hoarding disorder or just general like tendency to collect and pack rat all over the place, and it creates trip hazards and all kinds of. I can go on and on and on about that. So one of our program directors is a good thing. He says, "Hey, listen, this is my opportunity to say you have to work with us now. We don't want to put you out. That is the last thing that we want to do is make your problems worse because you brought them to us and want to care for you through it. So instead of putting you out over this rule violation, we're going to have our case managers work with you in some cases early on, every single day, multiple times a day, or as time goes on, a little bit less frequently, so that we can help you stay on top of this. So let's come by the case manager, and the case manager specifically, like he's very serious about it. It's got to be the case manager, can't just be the shelter staff, because they're going to bring the other solutions to wrap around the situation as well. Let me help you fold your stuff. We'll help you get it in bags, and we'll help you get it stored over here. And I'll work with you to figure out what you don't need right now, because you can't have all of this here for all of the reasons. And so it turns in what would be the kind of rule violation that, if persisted, would get someone booted out of shelter into an opportunity to engage people in case management services that then puts them on our caseload and helps them get into housing ultimately, and then gives them some strategies along the way for dealing with their tendency to collect. And so that's one of the things too, is where you see a flip from, we don't want to beat you over the head with the rules, that's the last thing we want, to here's an opportunity to gauge people in case management. I'll use that to also answer very briefly a question that was in the chat. It was, what does your data, so Deja, however, I'm sorry if I messed that up. What does your data show about repeat shelter entry among individuals and families, and which interventions have been most effective at reducing those returns over time? So what I will say, long story short, is there is a really strong correlation between engaging people in case management and positive outcome. If there was one thing that I've found, and we have researched this here at CAS, we have a researcher on staff, as we've done extensive research on this, and more than anything else we found from the shelter side, it boils down to, if we get people on caseloads, their chances of success in exiting and then staying out go way up relative to folks who don't work with a case manager. Now, some of those folks might be quick resolvers that don't work with their case managers, and so, that's great. But for those people who might stay a while, if they engage in case management, that's the number one driving factor that we've seen so far in getting people into permanent housing and having them not come back to us.
I'd also like to jump in on answering that. For individuals that are in our transitional housing program, again, it's a standalone program because it's a year-long program, as opposed to most of what other programs are available. But we have had since implementation 2 years ago, we've had a 99% success rate of individuals who are exiting our program into housing that they can afford with increased income, and we've had zero returns to homelessness. And the only reason it's at 99% was because we had to exit someone because they got in a fight on a property. But other than that, we've been able to show that if we are able to have you actively engage in those case management services, and we're actually moving the needle with your social determinants of health, that the results are phenomenal. as opposed to individuals that are in like our transitional housing programs. And then it's like 50-60%. It's pretty on par with rapid rehousing nationwide.
Thanks for sharing those examples. I really appreciate the audience questions that are coming in, and please keep asking those. I did want to shift to another topic that's been in the news because we've seen some cities in Arizona that have started restricting what can happen in public spaces, and that certainly impacts our unhoused population. Last year, Tempe passed and then rescinded an ordinance restricting large gatherings in parks. Phoenix is currently considering a restriction on the distribution of medical supplies and food in parks. So, what kind of impact do these ordinances or policies have on our unhoused population, and how is it affecting your work? What are you all thinking about these potential ordinances as they come up?
I took the last spicy one, Terrance. Why don't you jump on that one?
I'm on it. I'm all over it. I'm here patting people on the back. In the city of Tucson, they have done something that is super phenomenal. It's less about the city putting these restrictions on it and we're going to arrest you. It's how can the police work with the TPCH and the community and all of the available service providers to make sure that when these encampments are found, that they're bringing in all of the service providers to address these. And they're I don't want to say they're breaking them up. They are resolving these encampments one by one. And it's been the most beautiful thing I've seen. It's the best way that I've seen them address it. And I even asked them, and a shameless plug for the Arizona Housing Coalition, the city of Tucson will be doing a presentation on their encampment resolutions at this upcoming housing conference in May. So if you get a chance, you should definitely go check it out. In other counties that I work with, the sheriff of Cochise County said, yeah, we don't do that. I'm not here to arrest homeless people. I'm here to arrest people that are hurting people. If we're going to continue what we do, when we find them, we connect them to the outreach workers, to the shelter workers. But we're not going to be passing any ordinance, and I'm not going to fill up my jail with people who are just hungry and need a place to sleep. So it varies in the different communities that I'm in. I feel fortunate down in Southern Arizona that most of the communities have addressed this, not through legislation and making it illegal and arresting people, but through community coordination.
Yeah, I mean, I think that's right. I think that it's certainly some community based. I know that I'll be interested to hear from Nathan because I know that the city of Phoenix has taken steps there as well to improve the number of folks outside and sort of all of that I won't speak anymore on. But I think that in Flagstaff and in our community, I think we have commitment from leadership that those acts of frankly criminalizing, not having a home. We have commitments from our law enforcement that they're not going to be involved in that. And I think functionally, most of the time, that's right. I think it's probably disingenuous to say that it doesn't happen and it looks differently in certain ways. It's jaywalking and, smoking in parks or too close to buildings or, benches that are engineered to not have people lay on them. I think there's lots of ways that both through their criminal justice system and then just as a community, we write the narrative that we don't want to have people being alive but living outside. In Flagstaff, it has to do with the anti-camping ordinance and how long you can stay in a certain spot, before you have to move. And so there's this like thing where, if you've been to Flagstaff before, you know that this is a community that there are people who functionally rent space in houses and sleep in hammocks outside, right? Like it's a place that people want to be outside a lot of the year. And so it's hard not to look at that and think, well, that white guy who looks this certain way and doesn't look like he looks like he's had a shower recently and that kind of thing, like he can kind of get away with things that somebody who might historically look like someone who is maybe living in outside not by choice may not be able to get away with. So, I think that we are trying to have a better policies and better relationships so that those things don't happen. But I absolutely think it does happen. And that there's still a ton of work that goes that needs to happen to reduce those instances where people are being maybe arrested for just being alive. I think the other piece to it is, and Nathan, I'm sorry, I'll stop, but I think the other piece to it is that, and don't come for me, but or do come for me, it's fine. I'm used to it. I think if the world that we live in right now is turning towards, really, if you want to come inside, you need to be sober. If you want to, there's political movement in a startling and breathtaking way that really wants to say not only can you not sleep outside in this way or we're going to pick you up, but you can't come inside. The way that we're talking about legislation that would push shelters into position that they would be criminally held liable if they don't kick people out if someone is found to be using on site, right? Like there's all of these things that are making it really hard for these folks to be alive. And it's hard as a service provider not to look back at that and just think, well, you just don't want these people to exist at all. And so that's something we grapple with. I'm positive these guys do as well. And so I think thinking about the moment we're in and how we fight back at that is really, really important.
Yeah, I guess what I would do is thinking about this, zero in specifically on the ordinances related to large gatherings, food distribution, and distribution of medical supplies and care. Um, on the one hand, so I spent a lot of years as an outreach provider going into these parks where there's a lot of people. I actually started by doing large food distributions, and I got to see both the good and the bad of that. On the bad side, I got to see people pick through food, decide what they did and didn't want, and then throw what they didn't want on the ground next to a trash can and move on. And then I watched as fewer and fewer kids came to these parks, and my heart broke as a result of that. On the positive side, I watched as we got more sophisticated in it, we use them as an opportunity to engage people and say, hey, this food is more than food. It's a conversation. It's a chance for us to connect. Also, is there anything else that we can do to help you out? And a lot of times people would say yes, and we would get them engaged. So I'm not a hard liner on it, but if there is a, do not distribute food in parks type thing, it's not something that I would be completely against because again, I've seen the downside of it and you got to work hard to make the benefit. The medical supplies piece though, that to me is crazy because one of my favorite things that I ever did as an outreach provider was go with representatives of healthcare for the homeless, whichever agency had it. At one point, it was Maricopa County. Another point, it was Circle the City in here in Maricopa anyway. And in both instances, I can remember a time when I met a guy named, well, I won't say his name, but I met it, and this was many years ago, and the name is top of mind for me. There was a nurse practitioner who was just out there on the streets, and I was talking to this guy about getting help, and he was like, "Man, I don't really want all that. I'm cool out here." But he had this serious wound on his leg, and so I watched the medical provider glove up, get the resources out, address that wound, and schedule an appointment for him. I said, "Hey, man, how are you going to get to that appointment?" He was like, "I don't know." I said, "Hey, listen, I'll be here tomorrow. I'll pick you up," or whenever the appointment was, "I'll be here. I'll pick you up. I'll get you to that appointment." Sure enough, as hard as it was, and I knew this guy for a while, as hard as it was to engage him in services, when he got that wound addressed and he got cared for, he had something very practical to hang on to. He was like, it was the first time I got this guy to meet me for an appointment. And then he ended up getting housed. So he addressed what could have been the end of his leg right there in the park and ultimately got put on a path to housing. I don't see anything wrong with going into a park and providing medical care. And this is just Nathan. This is not Cass. I don't care what anybody thinks. I think it's completely wrong to say you have a wound. you have a situation and we cannot proactively come find you to care for you. So I feel differently about food and medical care, because I think to prevent medical care in any situation is just morally wrong for me personally. So anyway, I wanted to address that specific part of your question, Serena.
I just really appreciate the candor and just the thoughtfulness that you all approach these topics with. I wanted to dig a little deeper into medical care and talk a little bit more about health because I know we have a number of people who are joining the webinar today from the healthcare sector. And I would just love to know what each of you would like to ask people who are coming from the healthcare and health insurer spaces. What do you need from them by way of partnership and collaboration?
Oh, go ahead, Ross.
Okay. I was going to say, I think this is really a great one because again, going back to COVID briefly, one of the coolest things I felt like sort of came from that was meaningful relationships with healthcare, which, we'd, I guess, kind of always tried to get near the same table, with providers from a housing as healthcare perspective, but sort of came into full focus, needing to be not just in the same room, but at the same table, and really maybe eating family style, right? Like we needed to be at real healthcare conversations the way that we needed to have them at our table. And so I think those relationships, the more you can have relationships with your providers in your community, I can tell you one of the most successful things that Flag Shelter is doing right now in our congregate shelter that I think is really, really exciting is we've got the guidance center, which is our one of our behavioral health providers up here, literally not just co-locating, but staffing mental health providers through a partnership from 4 p.m. to midnight at our location. And they are literally there just to address behavioral health conversations with folks. And I can tell you, with having them on site, we've been able to connect people to detox if they needed it. We've been able to get them into appointments. They've actually had to title a few folks, but people that had been really just unwell in the congregate shelter for, frankly, years. But we didn't have the capacity or the know-how in our coordinating staff. So to have those partnerships, have them in place, it really is changing the way that we can do business and really help respond to the need of folks. And so I encourage you to make sure you're having those conversations with your providers and your communities because it's a huge, huge deal.
I'll go ahead and jump in. And if you don't mind, I'm actually going to start addressing David Light's question as well. I think that there needs to be we need to get creative again. The status quo isn't working. So kind of like what Ross was saying, another shameless plug. I'm working on creating a different type of housing community that will be able to address all different areas of life. So the individuals who are currently homeless, we need to have a place where they can go into for transitional housing. Those who have low income, we need to be able to create housing where we can afford to rent it to them for a $400 a month, where they would still be able to afford to live without a government subsidy. But to that, we would also need different innovations. The governor just released $100 and something million a couple weeks ago for rural healthcare. So in these new communities, making sure that we not only have a teledoc set up for them, but they have these new fancy little medical things where you can go in, put your arm in, it can take your blood pressure, and you can see the doctor, and they can come in, do blood draws, or providers that are able to come in and have a clinic day on site where they can meet with people. That way we are making sure we're providing access to them being able to improve their health without needing to get on 4 different buses to get down there, where we're able to bring that service directly to you. We can use the same teledoc technology to make sure you can see your psychiatrist and your therapist, and you can get your meds delivered. But it's incorporating all of those into a really just a more cohesive strategy that will allow us to be able to address everyone along the spectrum, even those who are just working poor. They work at Circle K, they get $15 an hour and they work 25 hours a week. Where are they going to live? We need to make sure that we're able to build housing for them too, because that's the next generation that is going to quickly slip into homelessness. So if we're able to start addressing all of those different areas at the same time, I think we'll actually see some forward movement. And again, like the person who is underemployed, great, let's get you. Do you have any vocational training? No. All right. Well, we have this list of classes that we work with, and we have funding that can help you get your CDL or your beautician license or welding license or any other vocational training that will help you be able to earn more and move out of that position. So that way, then the person who's coming in through transitional housing, now we have a place for them. So creating a better system. And as we started off with Nathan, and he was talking about all of the different innovations we were able to get out of COVID, it was when that amount of funding was available. That is what we were able to do, is find these new types of solutions. So for all of the different sectors that are here that are working health insurance, I know it's super beneficial to you if we can get your members off the street, improve their health. They're no longer sitting in your ER and running up your tab. And it's just the right thing to do. So I think that would really be where we need to be focused on for the future.
Thanks, Terrance. I cannot believe how fast an hour can fly by when we get to listen to really smart, thoughtful people. So we're going to wrap up, and I'm going to give a last couple, like, minute or so to each panelist to share any final thoughts. But I did want to just echo what Joan Service had just said in the chat, that this work is hard, and it's really refreshing to witness the respect between these panelists. And I'm just so grateful to the three of you for sharing your time. Nathan's Wi-Fi might have gone out in New Zealand, but he is joining us from literally across the world to share his thoughts. And I just really appreciate everyone being here today. And I really appreciate how engaged and thoughtful the audience has been as well. And I just wanted to end on a note of having each of the panelists share anything that's bringing you hope as you do this work, because it's really challenging work. And if there's something bringing you hope, let us know what that is. And if there's anything else that you didn't get a chance to share, please feel free to wrap up with those comments. Terrance, do you want to go ahead and get us started?
Sure. Having this meeting right now, the engagement and involvement from so many different entities, that everyone is now like focusing on addressing this. I've been in housing for going on 18 years, and to see this level of involvement and this many people caring, it just makes me hopeful that we will find these solutions and improve it.
Yeah, I think that's right. I think that I share that enthusiasm to be in this conversation with so many professionals. I'm looking through the list and seeing so many names of just folks I respect, and I'm in awe of that work that's going on there. I think I'm really I feel like there's, the old kind of adage of it's always darkest before the dawn, and I have a lot of hope that the dawn is coming, in terms of just really feeling like beautiful things can come from really hard times. And I think we've learned a lot of lessons post-COVID, and had we known what we know now going into COVID, how we would have done things differently. But I think it's preparing us to understand this and do better for the people that we're serving, and just continue to fight. I think there's hope in that for me, when I'm standing next to these giants in the work. So thank you.
Yeah, and closing us out, I think the thing that is giving me hope is with everyone realizing how resource strapped we are, how challenging it is to fundraise enough to fill the gap on your own, that it's becoming easier and easier in our landscape. People are far more willing to proactively partner with other agencies so that we can put our resources together in situations where we can't just afford to go out and do it on our own or buy it on our own. And so thinking of like the amount of mental health providers that Circle casts for a partnership, the amount of healthcare providers that Circle casts for a partnership. If I were to go down the list of things that we do at our older adult shelter, for example, that we don't actually do, but that our partners do, and it rounds out the service package that we provide. That is the thing that's giving me hope, is that as the resource availability continues to dip, or as Terrance put it earlier, become more and more uncertain, partnerships are coming alive and they're beginning to fill that gap in meaningful ways. And that gives me hope that we'll be resilient enough to weather the storms ahead.
Thank you all for sharing your thoughts. Your passion and dedication to this work really comes through on the screen. And I'm just so grateful to the three of you for not just being here today, but for all of the work that you do. And thank you again to the audience and to our friends at Flagstaff Shelter Services for co-hosting this webinar. We'll continue to have important conversations like these throughout the year. But thank you all for being here and participating in this webinar. It's been a great conversation. Have a great day. Thank you.
Thank you, everyone.